a 10-degree error in their location will result in a 30% reduction in the efficacy. So it's not a trivial proposition getting them aligned appropriately. If you're off by 30 degrees, you get no net correction of astigmatism, and you actually have an adverse effect, which is you rotate or shift the steep meridian, which would be even more disturbing to the patient than leaving the patient with their pre-existing astigmatism. I found that I can correct up to about 3 diopters in any direction. There's a very marked disparity in the responsiveness with the rule astigmatism as opposed to against the rule. With the rule astigmatism is much more difficult to correct, requires longer incisions. Against the rule astigmatism, on the other hand, is easier to correct, and I do not ever place an incision that's any longer than 50 degrees or so with against the rule astigmatism because of the risk of overcorrection that could occur. There are some surgeons that would advocate measuring and calibrating the depth of the blade according to the pre-existing pachymetry. I found the pachymetry in the periphery is somewhat unreliable, cumbersome to obtain, and I've had very good success simply using a blade that's preset at 600 microns. I have heard occasional reports of perforations using a blade set at 600 microns. I am happy to say I've not experienced that with the blades that I use. I think a blade that has good broad foot plates, is not excessively long at its base, is safer than one that has narrow foot plates that would allow you to tilt the blade, and blades with a broad flat surface are also, I think, more hazardous because if the blade is tilted, you get unanticipated greater amount of depth of the incision. In general, patients are extremely satisfied with the outcome of relaxing incisions. It particularly is true of those that have had astigmatism for many years and have experienced poor uncorrected vision because of their pre-existing astigmatism. One of the factors you always have to distinguish for patients is the accuracy of your relaxing incisions compared to the accuracy of your IOL calculations from the spherical equivalent standpoint. These incisions are going to be made at 6 degrees. With this particular marker, it's important that the eye be dry. And I can use the gauge on here, or I can just look at it and say, well, I know where 6 degrees is because it's just off just a fraction from it. Those two marks are very good, so this will be my 6 degrees. Again, I've got from here to here is 4.5, from there to there is 6, and from there to there is 8. And you can see that he has a large cornea, so I'm a little more central than I would normally be, so I'm going to back it up just a little so I don't get too central and leave him with some mild discomfort, foreign body sensation. And again, there's one edge of the mark, here's the other. Take it a little bit peripheral. And surgery is finished.